point in the journey should they see a myofunctional therapist?
So, when somebody thinks that they have any type of airway issues, airway concerns, or myofunctional disorders, the first step is always to see a myofunctional therapist. But why? Because we are the middle puzzle piece of this multidisciplinary approach. If you go to an ENT first, they're not likely to send you to a myofunctional therapist. But if you go to a myofunctional therapist, they're very likely to refer you to an ENT and a speech pathologist and a physical therapist and an occupational therapist, a sleep physician. So we have usually a myofunctional therapist will build this little community of providers, and we know who you should go to. I have a patient right now that has seen 4 different ENTs, and every single one of them has said that this child is okay, and the child is not okay. I mean, they are very much mouth breathers, cannot breathe. I mean, they sound like this, very, very nasal. You know, there's a problem. You look at them, they have this adenoid face, which is a very long face, deep purple bags under the eyes. You know, there's something going on. This child has a mouth open the whole time we're talking. And they said it was just allergies, just doing this nasal spray. So then I asked the mom, do you want to do this nasal sprays for the rest of his life? Like, what's the, what are you gonna do? But anyway, so that's why you should see myofunctional therapy first, because we can kind of tell what that patient needs next. Like, we are the quarterback, like my friend Nicole says, of the team. So we are gonna be here to guide you. And I tell my patients all of that, listen, this is a journey. This is not an easy, easy fix. A myofunctional therapy is gonna fix everything, or a tongue tie release is gonna fix everything. No. You have to see several providers. You have to be ready for that. You have to know that if you don't follow these steps, your results are not going to be as good. So by seeing one of us, many times I'll stop therapy and I said, okay, at this point, we've reached this goal, this goal, this goal. Right now, I really think that you would benefit from seeing a physical therapist, because I'm seeing, some changes in your posture, is bad, or your hips are not aligned, or you're walking on the tip of your toes. And there's different things that we can notice. If your knees are always locked, and then we'll send them to physical therapists and all these other providers. But that's why we're like, the cheerleader. I tell all my patients, I am here to hold your hand through this journey. Get used to me, because we're going to know each other and see each other for about a year.
Yeah.
Not every single week. I usually see my patients weekly, but not every single week. We might do, depending on what's next, if they need a tongue tie release, if they need expansion, if they need a sleep study, and, depending on what it is, we might see these people every 2 weeks, every month, until certain things get done. And then, but the whole thing is probably a year.
Okay. And I love that holistic approach, and that you're thinking of everything, because I'm very passionate about nutrition and also fitness. I do this program called Flowbility, and it's all about movement patterns. Have you heard of it?
So this is so funny. The first time I heard of it, you said, I saw on your page, on your TikTok, that you were, talking about, I was like, what is that? And then last week I had a patient from New York, and he told me he's been doing it. I was like, what? I just heard about this. Oh my God. So I want to learn more.
Oh my gosh. I don't think you can share your patient's name. I'm like, I wonder if I know them, but it's kind of hard to describe, but it's kind of retraining your body to move in the way that it's intended to. So from us sitting at our desk all day, we often dump into our lower back, and our hips get really tight, our hip flexors. So when we go to move, we kind of keep those imbalances with us. So we're learning how to actually like bend over and use our hips, not our back. And it's really like specific movements, but my back pain has gone away. Wow. There's so much of my body that's improved. And I've actually, this is so funny, but I've gone 1 inch taller than I was about a year ago from Flowbility and for my expansion. So having the less of the forward head posture to breathe. So the combination of those two, like working together, I feel so much better. And I'm like, I've measured myself so many times, and I'm like, this is insane. So
so cool. I need to look more into it. I'm curious about it, because I need it. I have bad posture. I have all the airway issues. So I would love to do it.
Yeah. Oh, that's so funny. Oh, cool. So, but yeah, I just love that holistic view and that you will send people like to who they need to see instead of like thinking in a box. So that is so great. So
Oh,
how, oh, sorry.
it's ringing. Go ahead.
So what's the best way for people to like self-diagnose themselves to see if they have an airway issue or if they should see a myofunctional therapist? Of course, like TMJ, tongue tie, people sort of know, like, what would be the best, way to
There's a
diagnose?
couple of things that you can do. One of them, you can try to take a sip of water, small little sip.
Mhm.
You're going to smile and swallow. You got to make sure that you can do that without swallowing air. Show me the, see, there you go. You want to close your lips.
Mhm.
That tells me that your tongue is not swallowing correctly. Your tongue is supposed to go way up to the roof of your mouth and create a vacuum seal. That's what's going to help you swallow. When you don't do that, you want to close your lips to create that vacuum seal. So that's one thing. If you cannot do that, you might want to see a myofunctional therapist. We're always thinking about what are the functions of the tongue, for example, or the face. What are things that you really need your facial muscles for? So breathing is one of them. If you're breathing in and out of your nose all day long and night, then you're fine. But if you catch yourself with your lips open, if you catch yourself with a lot of thirst at nighttime because your lips are open, chapped lips, those are a little bit of signs that you could be mouth breathing. If you have a hard time going up the steps, if you get super tired super quick, whenever you're working out, if you have to open your mouth after you've been walking or running for a little bit, that's a little bit of a sign that your CO2 levels and your oxygen levels are not very well balanced. We got to do something to make sure that you're able to hold on to more CO2 so you can actually use more oxygen. That might get a little confusing, but I can explain that later. But another thing, whenever you smile, do you see these black areas right there? That's called a buccal corridor. That means that my maxilla did not grow to its full potential transversely, so sideways. So if somebody smiles and you can see those black hallways right there, that means that their maxilla did not grow enough. So there's things that we can do to help the maxilla grow. What else? My goodness, there's so many things. If you open your mouth comfortably and you lift your tongue up, just your tongue. Very good. You're supposed to be able to almost reach the roof of your mouth.
Okay.
But now we want to make sure all of our bodies are very intelligent, so we're always trying to find compensations here and there. So if you hold the floor of your mouth down, because a lot of times the floor of the mouth goes up and it helps you get up there. Now let's hold the floor of our mouth down. Same thing. Open up, hold, and now try to lift your tongue up. You really got to put your finger there and hold it down. Do you see how mine doesn't go up? There too.
Got it.
That means that there's a restriction there. So that frenum, that little tissue tag, or the little tissue underneath the tongue, either attaches in the wrong place or it's too short, but it's preventing my tongue from having full mobility and full range of movement that you need in order to perform these functions that we're talking about. So breathing, tongue position, just your rest position, it's actually a very important function of your body, where your tongue stays, how your lips stay, and then eating. So our tongue needs to be able to lateralize, go from side to side, to carry our food from one side to the other. Your tongue needs to be able to collect all of the food and then put it all in the middle of your tongue in a little ball shape of food, and then swallow without using any of these muscles, just your tongue. So those are a few things that we're looking at as a myofunctional therapist.
That's so interesting. I know that chewing, I have a lot of work to do, of course, but I know that switching from nasal breathing when I worked out, I thought that you weren't supposed to nasal breathe when you worked out. I had no concept of it. I feel so much more calm. Like I'll do a really high intensity workout or I'm sprinting and all that. And I'm like, I just feel relaxed now that I'm breathing through my nose. And it's crazy.
I think it was on Patrick McEwen's book that I read that if you have, high intensity workout, usually those times about 40% of the time it's okay for you to open your mouth. But everybody else should be okay breathing through their nose only. I've never been big in working out, but a few years ago I started running because I had like 10 minutes in the morning. I figured if I run, I would do better than just walking because that's all I did was just walking.
Yeah.
So I started running and it was extremely hard for me. Everything hurt right here because I wasn't breathing right? So when I started doing on the treadmill, I started focusing after I read Oxygen Advantage from Patrick McEwen. I started focusing on nasal breathing and my nose would run like crazy as I'm running. You just clear liquid just comes out until you get used to it.
Right.
And as you get used to it, you're able to run the whole time with your lips closed. And as soon as you stop, you're talking just like me and you, out of breath. The second you open your mouth, you get tired.
Yeah, that's good to know. Yeah, it definitely took me a while. It was not easy at first. I was like, oh, I feel like I'm relearning how to run, but yeah, I feel so much better. Okay, so that's really helpful now that I have like a self-assessment of someone to know when they should see the myofunctional therapist. So I think my next question would be in terms of TMJ, and for me specifically during the expansion, is there some cases where, or if someone needs to expand, is it still helpful for them to do myofunctional therapy? Like, can they still benefit just as much? Okay.
Always, because we got to think about it. Even when a baby's born, they're already born with oral facial dysfunction. So throughout your whole life, your body, your muscles are going to engage to be able to perform these normal functions. Sometimes it engages the wrong muscles, but it has to get it done, right? You have to breathe, you have to eat, you have to keep your tongue in the right, it's somewhere. So we have to correct those. A lot of times the lack of space is an issue and you need to expand. But what happens if you change the way that the bone looks or, the size of things? You have to address the muscle. The same thing whenever you have a hip replacement or knee surgery, you have to do physical therapy afterwards because you got to get the muscles ready to that new structure. So it's the same thing. Anytime that you have any facial surgery or treatment or anything done that could change the structure, we recommend myofunctional therapy because now we got to teach those muscles how to perform with that new structure.
Right. And I love that example of, physical therapy after surgery. Like it makes sense. And my doctor was talking about, my TMJ doctor, when people get surgery for their jaw, but don't do all the exercises and working on the muscles after, the surgery might not work or perform as well. And that was really interesting to me to make sense.
People relapse all the time. The main things that are going to make people relapse after expansion, after MMA surgery, are if they're still not breathing through their nose, if they're not chewing on both sides effectively, and if they do not have good oral posture or rest posture. Those three things are going to make you relapse. It's a great, I'm going to do that one.
Yeah, I was going to say that because I hear so much about surgery and I was like, is that an option for me? Like it sounds intense and surgery is a big deal. So that's really helpful to know those points.
That's crazy that you have, you don't, looking at you doesn't look like you have sleep apnea. Did you say you have sleep apnea or just CMD?
Well, I think that I do. It's not that intense and like severe.
Not diagnosed.
Well, I got my sleep test and I had like I think a very mild case of it. I would always like sleep for, 8 hours a night and sleep really well. But I would wake up feeling tired, even though I slept for a lot. I didn't really snore, so I didn't really have any of the symptoms. My doctor said, of course, it'll get worse as I get older. And, young females are often misdiagnosed. So I'm already feeling a lot better. Like when I sleep, I'm like a year into my treatment and been practicing nasal breathing as much as possible, trying to get the proper oral posture and everything. But I know it's only going to get better and better. So I'm excited.
Yay. How much longer do you have with the DNA?
Ooh, maybe a year or a little bit less. I was working full time before, so I couldn't wear it as much, but I recently quit my job and have more time. So,
No way.
so
Nice. Very good.
yeah,
So, okay. So it's the amount of time that you've been wearing it.
yeah. So
So,
maybe a little bit less than a year. So I'm excited.
it's going to be great. Do you have any issues nasal breathing?
Not really. It's pretty good for me. So I just have to build that habit.
Perfect.
Yeah. Yeah. That was most of what I had for this. Has been so helpful. I'm like, I'm so excited.
That is awesome. Well, send me this recording. I'd love to share also with our group. I know that it can help somebody.
Yeah, totally. That
So
we'll stay in touch. Yeah, it was so nice meeting you too. And I appreciate your time and everything. And we'll be in touch.
yes, awesome. Make sure you tag me on TikTok. I need to grow that.
Yes, I'll try to restitch or repost things too. You will soon. It's just a waiting game. I'm sure it will happen very soon.
All right. Thank you so much. Bye, girl.